Hello, this is Sudharshan, and in this episode, we will talk about chapter 40, that is food poisoning. So, let us discuss some common agents with respect to the food poisoning. We will talk about Staphylococcus aureus, Bacillus cereus, and botulism. So, coming to Staphylococcus aureus, which actually produces an enterotoxin, as the name itself tells. Entero means intestine and toxin means a harmful substance. So a harmful substance which is produced in the intestine that causes the damage. So GI related symptoms like abdominal pain, nausea, vomiting, diarrhea, etc. will be seen. And roughly there are some 15 serotypes of this enterotoxin in the Staphylococcus aureus. And coming to the diagnosis, it is through molecular methods like ELISA and PCR, and the treatment will be supportive. So please remember, any GI infection, whatever it may be, there is a supportive treatment. Medications generally are indicated only if the infection is very severe. Next, coming to Bacillus cereus. So Bacillus cereus is a gram-negative bacilli which is spore forming. It forms an endospore, and very commonly it produces two important toxins, diarrheal and emetic. As the name suggests, diarrheal one will cause diarrhea and the emetic one will cause vomiting. With respect to incubation period, emetic is 1 to 6 hours and diarrheal is 8 to 16 hours. And very common food items will be rice, especially when the rice is not cooked properly or reheated. That is how B. cereus or Bacillus cereus spreads. And also sometimes there may be a disseminated infection as well. And coming to the diagnosis, it can be detected using a very important selective media, MYPA, where M is mannitol, egg yolk, polymyxin B, phenol red agar. So MYPA medium will be used. And coming to the treatment, it is again mostly supportive. And next, coming to botulism. So it is a condition that is caused by C. botulinum or Clostridium botulinum. It is a gram-positive bacilli and it is spore forming and obligate anaerobe. That means oxygen is needed for the survival. And very importantly, botulism produces a very important toxin called as botulinum toxin. So this will go and suppress the neuromuscular junction that blocks acetylcholine release, and because of that we see flaccid paralysis. And coming to the clinical features, we have the Horner syndrome like ptosis, meiosis, anhidrosis, enophthalmos. Apart from that, we can have diplopia and different other muscles being affected, like if the laryngeal muscles are affected, we can have dysphonia, or if the esophageal sphincter is affected, we can have dysphagia. So there might be deep tendon reflexes, GI sphincters might be affected, so there may be malabsorption leading to constipation. And most importantly, two types of botulism, one is in adults and another is in children. So adults very commonly in canned food and children very commonly honey, the spores. And there are other types like inhalational, like breathing in the spores accidentally. It may be iatrogenic or physician induced. Coming to the diagnosis, automated techniques, Malditoff-Whitek, ELISA, PCR. Apart from that, the culture, isolation of the bacilli. And coming to the treatment, again it is supportive care, and here a promising medication called Botox A is there, which will neutralize the botulinum toxin. So that is all about food poisoning. So thank you so much. We'll see you in the next lesson.